This is Dr. Robert Watkins, orthopedic spine surgeon to professional athletes and creator of the Back Doctor app. Today's podcast is on stem cell therapy. An update as of April the 1st, 2019. We'll review what are stem cells, how are they potentially going to be used, what are the downsides, what are the potential benefits, and where do we see things moving towards in the future. So first of all, let's define a stem cell. A stem cell is a very beginning, basic, amorphous cell. It can become anything: muscle, skin, bone, tissue, disc, nerves. So we call it an undifferentiated cell, which means it has not differentiated to become a different type of cell. It has the potential to become any type of cell. So there are two main characteristics of stem cells. Number one is undifferentiated, which means it has the potential to become anything. Number two is it can replicate. It can actually clone itself, which can allow it to expand and become more cells. So those are the two fundamental characteristics of stem cells. Now, how do stem cells play a role in medicine and treatments for? Well, what's the fundamental problem with life? It's aging. It's that we're all dying. We're all getting older. We all peak around age 28, and it's a slow decline to hell ever since. I'm somewhat joking, but that's absolutely true. That's why athletes peak around age 28. That's when we're at our optimal. And we used to die around 50. Well, now we live till we're 90, which is great. The problem is our joints and bones and ligaments and brains are all starting to fall apart around age 28. That's a long way to go of this slow decline. Therefore, it creates this market and this need to revitalize ourselves, the fountain of youth, get ourselves back going again, because who wants to be dying for the last 70 years of their life? So the idea of stem cells is to put these new cells into the body to reinvigorate and rejuice it, get pumped up with this new blood, which has been done for a long time. I mean, maybe it started with sex with virgins, or maybe it took the afterbirth and people cooking it up into a soup and eating it, smoking it, drinking it, rubbing them on themselves. I mean, humans, this is not a new thing to humans. We've been doing this for a long time, trying to revitalize ourselves and be young and strong again. So it is a fundamental problem that is real. Nobody wants to age. There are a lot of bad things that happen with aging, but it's also a problem we've been trying to solve through voodoo and magic and some science from the beginning of time. So what's one of the problems with taking these stem cells, these new cells, and putting them into an aging body? Well, number one is, are they really going to make a difference? So you inject these young, vital stem cells into your body, this old, decrepit body, what difference is it going to make? And that's the big question is how much effect is it going to have? How much risk is there to inject these things? How long are they going to last? Is it worth the cost, the time, the effort, and the potential risk to inject them? Because how much are they going to work? And that's where it depends on, well, what are you injecting? Where are you injecting it? What's the fundamental problem? And that's such a gray zone. Every age of person, every type of physiology and biology and pathology is different. And therefore, there is no one answer as to do stem cells work or not? Well, it completely depends on the situation. Another main problem with the stem cells is if they really work and they're really vitalized in these vibrant cells that are going to clone themselves and procreate and distribute and differentiate and do all these amazing, fantastic things, well, you better hope they don't do too much. They're not too good and not too powerful, because then they'll become a cancer or a tumor. Tumors and cancers are basically cells gone wild. If cells just overproduce and are too powerful and get out of control and don't have their own regulation, they become these growths in your body. Like you'll have a muscle that'll just overgrow, start to spread around your body, take over your heart, your lungs, and well, that's a cancer. That's metastases of cancer. So you want these cells to be powerful enough to work, to be worth doing, but they also need to be able to shut off and work within the body. And that's one of the fundamental problems if you're injecting these big, vital cells, these young, healthy cells into an old, decrepit body. Where's the mismatch going to occur? Is it going to help, or is it going to potentially hurt? And the reality in medicine and in life, what we typically see is that it's an odds game. Maybe it'll help 90% of people, but 3% will get some type of tumor or growth. Well, then it depends on what is that ratio of how much people does it help, how many people does it hurt, and is it worth doing? And we just don't know the answer to that yet. So let's go over the 3 most popular stem cells that are being used today in medicine. Number 1 is adipose. Number 2 is bone marrow. Number 3 is umbilical cord. Number 1, adipose. That means fat. These are fat cells. And this is really started with dermatologists and plastic surgeons who do a liposuction, suck out some of the fat instead of throwing it away, say, hey, look, can we use this? And basically, you can take the fat cells, process them, spin them down, get stem cells out of them, which are the natural stem cells in that person's body. Then you can inject it back into them. You can inject it in their face and their boobs and their penis. It's being injected all over the place. You can imagine, especially in Los Angeles, if you have the body part, we can inject it. And there's some validity to it. I mean, there's people who have claimed it works amazingly, and it might. So the adipose is number 1. Number 2 is bone marrow cells. And a lot of orthopods, we're used to doing this. I take bone marrow aspirate or bone marrow samples for fusions and for different procedures. So it's a very accepted way to do it. You aspirate the bone marrow, usually from somebody's hip, basically their iliac crest and the pelvis. We can suck out some of the bone marrow and probe for it and harvest it through a very safe, reasonable technique that we do all the time. A light anesthetic is nice, so the person just doesn't have to feel it, but it's pretty atraumatic, and we're used to doing that. Well, those are bone marrow aspirate cells, and so they basically come from the bone marrow, and they generally are their purpose is to become bone-making cells. Number 3 is umbilical cord cells, and this has become more popular recently, and this is basically, the umbilical cord is just an afterthought. We just kind of throw it away, and again, it's, well, can we use it? Can we do something with it? And the umbilical cord is interesting. Proponents of umbilical cord say it's like this magical tissue that basically does not cause any immunologic reaction in a person. You can take it from one person, give it to another one. It doesn't stimulate any type of bad inflammatory immunologic response, and that it has the ability to stimulate the person's natural body to heal. And so again, remember I was talking about the old witch voodoo doctors. I mean, they probably use this stuff for everything you can imagine, and it's a similar kind of idea. But it also has some basis in science. These cells have really been analyzed and looked at and found to be potentially very powerful and effective. And also with the umbilical cord cells, you can have amniotic fluid. And in the amniotic fluid, there's a lot of cytokines, protein mediators that can help stimulate a healing response in the body. And so some of the people I've spoken to say it's not just the stem cells in the umbilical cord, but it's also the amniotic fluid with all the proteins. That's all the juice that stimulates the natural healing response in the person's body to go to the affected tissues and to heal them. But, that's a lot of just theorization and speculation. Does it really stimulate your body to go to the area of pathology to fix it? How do these cells know where to go? And there's some question in that. One interesting concept I heard is that you can't mark stem cells, with like a radionucleotide or a tracer to know where they go, because when you mark them, you change them, and therefore they're not stem cells anymore, or they're not as effective. And that's kind of a cool concept. Like you can't be totally objective, because by watching a subject and observing it and measuring it, you affect it. And so I don't know if that's true or not, but that's what I've heard and even read about. Anyway, moving on, back to the adipose and the bone marrow. Those are both very accepted medical procedures. They're safe, and so you can do them in hospitals and do them in accepted medical facilities in America under FDA regulation, because we know how they work, and they're just an accepted path. But what's the downside to taking someone's own fat and bone marrow cells and trying to get them to become a different type of cell? So say you take somebody's bone marrow aspirin and inject it in their knee and try and regrow cartilage. Well, is that tissue going to become cartilage, or is it going to become bone, which could be extremely harmful? Or I've even heard reports that sometimes it becomes muscle. And then the other component of that is, so they're already down the path of some differentiation into that type of cell, either fat or bone marrow. But number 2 is, people say, well, they're old cells. You're taking them from an old person and injecting them back into the same old person. Who wants some old stem cells? I want some new stem cells. Give me the young ones. Give me the fresh ones. And that's where umbilical cord cells come into play, because they're young, they're early, they're undifferentiated. But the downside to this is it's coming from another human. So that's called allograft. Autograft is from the same person. Allograft is from a different person. And so if these cells are coming from somebody else, well, then you need to process them in some way so that you don't get an infection. That's number one. But then how are you going to process these to get rid of the infection and still preserve their viability? They still got to work. You can't just irradiate them and throw them in a microwave and nucleate them because you'll kill them. You got to preserve the viability at the same time. You got to make sure there's no infection. And there's a recent company here in Orange County called Livion that I actually had a patient. I had this old patient, he was probably in his mid 80s, who was having back pain, couldn't get in touch with me because I was probably out of town skiing or something, and went to a local chiropractor, had an injection of stem cells to treat his back pain from this Livion company. The guy ended up getting sick that night. His wife was smart enough to call 911, got him into the hospital. He had sepsis. He had an infection going through his blood. He almost died. And literally, I saw him like 2 weeks later, and he was okay. I mean, he got treated pretty quickly and resolved within 3 to 5 days. And but he literally, I was thinking about doing stem cells and doing research, and the guy walks into my office and tells me this crazy story about how he almost died from the stem cell injection. And so it's real. My point about that is it's not some theoretic concept, oh, can you get an infection? I had a patient almost died from a stem cell injection here in Los Angeles just 2 months ago. So that's the risk, is how are you going to process these cells where you get rid of the infection, but you preserve the viability? And at the same time, hope that they're not too strong that they cause cancer and tumors. So where do we stand now? I believe stem cells will have a role in the future of medicine. They're incredibly powerful. They're very organic. We have them in us. When we learn how to trigger them and stimulate them and reproduce them, it's going to work. And it already has been shown to work in certain diseases. But it's probably not the cure-all for everything, or at least it's going to take us another 50 years to really figure out which ones work for what purpose, at what time, at what cost, how often, those types of things. Part of the problem now is it's very ill-defined now. Now, some proponents of stem cell therapy today claim that the drug industry, which is extremely powerful and huge and monetarily beneficial, and a lot of the people who work for the drug companies then work for the FDA, and for the FDA go back and work for the drug companies. And so the FDA is a very important organization in America. It really does protect us. It protects patients. It takes a lot of grief in this country because it costs like 7 years and $100 million to get certain products through the FDA. And everybody, a lot of my friends and different people say, oh, Europe is so much ahead of us in a lot of different products and stuff like that because they don't have the FDA. Yeah, well, the FDA protects us. And so it really has a vital, virtuous purpose and is essential. But at the same time, there may be some advances, and it may be affected by the drug companies and the drug market. So are all our politicians. So are our doctors. So are the patients who get marketed to. So anyway, one of the downsides of America, one of the negative claims is that stem cells cannot be patented. Therefore, they're free and can be used by everybody. Therefore, the drug companies do not want them because they can't make money off them. So they're going to try and badmouth stem cells and try and kill it and squash it because it's cutting into their business and into their dollar. And I don't know the exact specifics of that, but it is a plausible argument. At the same time, it's not the whole picture. There is a lot of, it's multi-layered and complex. But the bottom line is there are no good controlled studies as of today that show the efficacy of stem cells. And you can't publicize your results of stem cells in America because the FDA has said you can't do that. Therefore, a lot of the people who use them really only claim case reports, like one-offs. Oh, this patient had this, I cured them, they did great. And I've read books and I've talked to a lot of doctors who are doing these types of therapies, and they all tell me, oh, I had this patient had this problem. I fixed them with stem cells. It worked out great. And that's one of the downsides is a lot of the doctors, or maybe I should just say healthcare providers, because they're not typically MDs. A lot of these practitioners of stem cells will tell you these case reports. Well, as an MD who spent 4 years of medical school, 5 years training, 1 year fellowship, 10 years of schooling and training and regimented beating it into my head, case reports are worthless. I can pull up a case report that proves anything. I mean, and so to show me case reports as though to prove something works is insulting to my knowledge as a scientist and a rational thinker. You got to have a controlled study. You got to have one group that gets the treatment, one group that doesn't get the treatment, and run it out. You got to have 500 of each, and you've got to prove statistically that this thing made a difference. That's science. That's Western medicine takes a lot of heat. Well, that's what Western medicine is. Show me the science. Show me the data. It makes sense. That's what our children are taught in 7th grade. And there's a reason for it, because case reports are all over the map. I can show you a case report that proves anything you want to hear. So anyway, that's where stem cells stand right now. It's a bunch of case reports. There is no good data. And the data that has been out there, the research that has been done, hasn't shown anything to really work with any statistical significance. Now, believe me, every university in America is working on this problem. Like low back pain, it's the number one problem affecting America. Missed work, days off work, millions and billions and trillions of dollars are spent. So if somebody finds a stem cell treatment for back pain, for degenerative disc disease, it's going to be a multi-trillion-dollar discovery. They're all working on it. If it was out there right now, you would have heard about it. It'll be on the cover of the Wall Street Journal. It's going to be massive. And I think it will happen, but it's a long ways off. So one of the problems now is that you've got all these treatments that are occurring in America and also down in Panama and other countries and different places where the regulations aren't as strict. And one of the downsides is they're taking advantage of vulnerable people. Now, I'm not saying that those doctors and those healthcare providers aren't righteous people who are helping people. They may be. But at the same time, they're also taking advantage of a vulnerable group of people. There are parents with kids who have diseases that are desperate and trying to help their child. There are parents who have parents, people with older people with dementia and with Alzheimer's and all these crippling diseases that are just horrible, that are desperate to try and help their parent. And then there's also people with back pain and knee pain and joint pain, which is all of us after the age of 40. Now that I'm 47, I can say that. And so there's a lot of desperation and people in need, and this idea of something that can help them is very appealing, and they're willing to spend a lot of money and time to do it. So what about indications for spines, which is really my area? As of today, there's 3 main areas that you can inject in the spine. There's the disc. Degenerative disc disease, 80% of all the biomechanical activity happens in the disc. So if you got low back pain, it's probably your disc causing the pain. Degenerative disc disease, that's number 1. Number 2, facet joint disease. For every disc in the front, you got 2 facet joints in the back. They only load 20%, so the chance of them being a major source of pain is not very high. In fact, in my practice, I'd say it's like 5 to 10% of people have facet joint pain of any significance. Most of it's all disc pain or nerve pain, and that's the third category. You got nerve pain, which goes down the leg, numbness, tingling, weakness, pain down the leg. That's the third source of pain. So the first thing, injecting the disc. That's the gold money. If you can figure out a treatment to inject a disc to heal degenerative disc disease, that's the $1 trillion discovery. Well, the problem is the disc is acidic. It has a low pH. It's hypoxic, has no oxygen. It's avascular, has no blood supply. It's made up of 2 components, an annulus on the outside and a nucleus in the middle. And those 2 things are completely opposite in their ratio of proteoglycans and collagen. So when you talk about injecting a disc, well, which one are you injecting, the nucleus or the annulus? Right there alone. You got to inject both with 2 different substances most likely, because it doesn't make sense to inject one thing to heal them both. They're totally different. And biomechanically, once the disc is shot and worn out, how are you going to fix it? How are you going to heal it with just a simple injection? So degenerative disc disease is the big one. It's also going to be the hardest one to fix. And like I said, universities all over the country have been doing this for the past 10 years. No study has shown any difference whatsoever as of today compared to placebo. Now, here's the interesting part. Both of them, placebo, which means injecting saline, and injecting stem cells, both have shown a 30% improvement. That's the placebo effect. So people do get better. So those case reports I'm talking about, well, 30% of people feel better. So you're going to get 30% case reports, but it's no different than injecting water. Therefore, it's not scientifically, functionally valid, and it's not worth the risk, and it's not worth the time and the money to do it. All right, number 2, the facet joint injections. Now, this is where it's interesting because all these other biologic products, PRP, Regenikine, there's a new one, I can't even remember the name. There's a lot of them out there, these biologic solutions. You know what they all basically claim at the end of the day? That they really help facet joint pain. Well, you know what? I already told you facet joint pain is only like 5 to 10% of my patients. So you're going to inject 100% of people hoping that 5 to 10% who actually have facet joint pain as their primary problem are going to be helped. But anyway, there's tests you can do to show facet joints are the problem, like a CT bone scan. You can inject them with lidocaine. You can tell just on MRI. So if you really think it's facet joint pain, doing a biologic stem cell type of injection of the facet joints is a reasonable option. It's just not that big of the market. And the third thing is the epidurals. Somebody has nerve pain. Right now, if somebody has nerve pain, I inject cortisone, an anti-inflammatory steroid, which we know works, gets rid of the inflammation, has a long proven track record. The downside is you can only get like 4 or 5 in a year, which is, I've never injected more than that because most people don't need that often. Injecting stem cells to heal the nerve, well, you'd better decrease the inflammation because that's the fundamental problem. So doing them for epidurals isn't really needed because you're not injecting a joint. You're just injecting around a nerve, where the anti-inflammatories are really what you need is what the steroid does. So going forward in my practice, I do injections. So I'm very interested in the biologics and in the stem cells, but I also really think, what would I have injected in me or one of my children or somebody I cared about, and so doing facet joint injections, if you can afford them with a biologic, if you need them, 4 times a year, a very reasonable thing to do if you can afford it. Number 2 is stress fractures, spondylolysis, pars defects, stress fractures in athletes. That's actually one that I think may be very appealing because injecting a steroid around that stress fracture can decrease the inflammation, but it may also retard the healing. It's never been proven to, but it might. Whereas if you inject a biologic that can potentially decrease some of the inflammation and help the healing process and save somebody 20% of the healing time, well, it may be worth doing. And it's extremely safe because I'm not actually injecting into the spinal canal. The stress fractures and the pars are dorsal, they're outside of the canal. And so it's an extremely safe thing to do, that the worst case scenario is extremely low. It would cause any bad problems. So the point is, I'm still looking into where's the utility for this. I think there will be some functional utility in the future. Right now, there is no real data that shows any real benefit. So then it comes down to, well, can you afford it? And if the risk of the procedure is really low and we can make them cost effective and say it may help with 20% of healing, like I said, of these stress fractures, I'm probably going to start doing it. I may start with the iliac crest because it's a proven way to do it. Although the umbilical cells, I think if they've been processed properly, do have real potential to it. And it's a fascinating field. There's a lot of misunderstandings out there. If I can help in any way, please feel free to email me at robertwatkinsmd@yahoo.com or check out our webpage, watkinsspine.com. Bye.